Hi everyone. Thank you all for tuning in to UCSD APhA-ASP's Love Your Heart educational video. My name is Ryan Ha, and I'm the Operation Heart Hypertension Chair of APhA at UC San Diego SCAG School of Pharmacy and Pharmaceutical Sciences. I'm joined by Isabel No and Yvonne Du, and we're all pharmacy students at UCSD. Love Your Heart is an annual event in which organizations around the US and Mexico join together to offer free blood pressure screenings to the public. Unfortunately, due to the ongoing COVID-19 pandemic, we aren't able to offer our annual screening event this year on campus. However, we put together this educational video to teach you all about hypertension, also known as high blood pressure. You'll not only learn how to take your blood pressure at home, but also how to prevent and manage your high blood pressure. We hope you find this video helpful and share it with your loved ones. And with that said, let's jump right into it. So what exactly is hypertension? Well, hypertension is the diagnosis of high blood pressure, and blood pressure is the force your blood creates on the walls of your arteries as it flows throughout your body. Now, why is having high blood pressure a bad thing? This is because your heart and blood vessels will have to work harder to pump blood throughout your body because of that extra pressure. This can cause your heart and blood vessels to weaken over time. The walls of your arteries can become damaged, which can lead to a variety of complications such as plaque buildup. And what are the symptoms? You may be surprised, but typically there are none. High blood pressure can be dangerous because many people who have it don't even know that they have it, since they feel completely fine and don't have any symptoms. This is why high blood pressure is often known as a silent killer. And so it's important to know whether or not you have high blood pressure so that you can start taking the appropriate measures to address it and stay healthy. There are rare occasions when patients with severely high blood pressure experience some symptoms, which we'll get into later. Here, we have a couple of quick facts about high blood pressure in America. Nearly half of adults have high blood pressure or are taking medications for it. That's roughly 108 million people, and only 1 in 4 adults has it under control, which is definitely concerning. Nearly 500,000 deaths in 2018 included high blood pressure as a primary or contributing cause. And lastly, about 1 in 3 adults with high blood pressure don't even know that they have it, highlighting the silent killer nature of this disease once again. So as you can see, high blood pressure is definitely a disease that needs more attention and addressing. So where does this start? Well, it all starts at home. Specifically knowing your blood pressure numbers and checking it regularly at home. You may have seen some of these home devices that automatically measure your blood pressure on the shelves at your local pharmacy. Even Amazon has many options. However, picking a blood pressure monitor can be very confusing with all the choices out there. When looking at automatic blood pressure monitors, there are typically 2 different kinds: bicep cuff and wrist monitors. Bicep cuff monitors are pretty much the gold standard and are recommended by the American Heart Association for at-home use because they produce the most accurate readings. However, they can be a bit more expensive and some people find them uncomfortable. Wrist monitors are the other option. They tend to be more affordable and comfortable. However, the reason that they're not recommended by the AHA is that they aren't as accurate. But whichever option you go with, the key is to follow the directions and be consistent with monitoring your blood pressure regularly. Checking your blood pressure regularly is something everyone with high blood pressure should do, but many don't know how to do it correctly. Routine checking will help you know if you have it under control. If you have high blood pressure, talk to your doctor to figure out how frequently you should be checking it at home. But for most people, twice in the morning and twice in the evening will help you and your doctor get a better understanding of your blood pressure. For morning measurements, it's best to take those before you take your blood pressure medication. It's also important to avoid exercise, caffeine, and tobacco at least 30 minutes before you measure because they can affect your reading. If you need to go to the bathroom, it's important to do so before your reading. Now I'm going to demonstrate how to use an automatic bicep cuff monitor at home. Find a quiet place to sit where your back is in a supported upright position, such as in a dining chair. Then make sure that your feet are flat on the floor and that your legs or ankles are uncrossed. Next, rest your arm on a flat surface with your palm facing up. Place the cuff on your bare upper arm just above the elbow. Make sure the cuff fits snug around your arm but is not too tight. Your arm should be relaxed and resting so that the cuff is at the same height as your heart. Now, you'll rest quietly for 5 minutes before taking your first measurement. Press the start button on your monitor and avoid talking while the measurement is being taken. The cuff will begin to inflate and deflate during the process, so you may experience some temporary discomfort, but this is normal. Once your measurement is complete, write down your numbers displayed on the device for your records. Wait 1 minute and repeat this process over again. And you're done. It's important to take your 2 measurements around the same time each morning and evening for consistency. Be sure to discuss your numbers with your doctor so that your care plan can be changed if necessary.
Hi everyone, my name is Isabel Ngo and I'm a first-year pharmacy student at SCAGS. If you ever had your blood pressure taken before, you probably recognize that there are 2 numbers. But what exactly do those 2 numbers mean? Here we have a nice, easy-to-read chart adapted from the American Heart Association, so you can see what blood pressure category you fall into. As a disclaimer, this chart is not an official diagnosis for hypertension, so it's always a good idea to discuss your numbers with your doctor for a formal diagnosis. Blood pressure is defined into 5 different categories: normal, elevated, high blood pressure stage 1, high blood pressure stage 2, and a hypertensive crisis. The first or top number from your reading is the systolic blood pressure, which is the larger number. The second or bottom number is the diastolic blood pressure, which is the smaller number. As you can see, the higher both of these numbers are, the worse the condition. For a normal healthy adult with no complications, a blood pressure that is less than 120 for systolic and less than 80 for diastolic is considered normal. However, for adults diagnosed with hypertension, the treatment goal is a blood pressure that is less than 130 for systolic and less than 80 for diastolic. If you find that your blood pressure begins to worsen, you should have a discussion with your doctor. As we discussed earlier, there are typically no symptoms for hypertension, which is why it's often called the silent killer. Even patients with dangerously high levels of blood pressure may not experience any signs or symptoms. However, a few patients with severe hypertension may have headaches, tiredness, blurry vision, chest pain, or even difficulty breathing. Again, without any symptoms, the only way to know if you have blood pressure is to measure it. Now, because blood vessels run throughout your body to supply it with nutrients, having uncontrolled high blood pressure can lead to some serious damage in various parts of the body. Uncontrolled hypertension can potentially lead to stroke, vision loss, heart failure, heart attack, kidney disease, or even sexual dysfunction. This is why it's important to first identify that you have hypertension so that you can start taking steps towards bringing it under control. There are multiple risk factors for hypertension. Some are preventable, while others are not. For the preventable ones, we have an unhealthy diet. Having an unhealthy diet can increase your risk of developing hypertension and even other diseases. Being obese or overweight can also increase your risks, along with a lack of physical activity. Smoking and excessive drinking can actually raise your blood pressure and increase risk as well. For the non-preventable risk factors, age is something that affects everyone. The risk of high blood pressure increases as we age, and the hypertension becomes more common in men over 55 and women over 65. Hypertension also tends to run in the family, and certain chronic diseases such as kidney disease, diabetes, and sleep apnea can also increase risk.
Hi everyone, my name is Yvonne Du, and I'm a first-year pharmacy student at SCAGS. So now that we know that high blood pressure can be prevented and managed, how can we decrease the preventable factors? Well, now we can start by incorporating some lifestyle modification into our lives. Maintaining a healthy weight and keeping a target BMI in the normal ranges of 18.5 to 24.9 is great. It is normal to note that this range is a bit lower for those of Asian descent. Limiting alcohol consumption to a maximum of 2 alcoholic beverages for men and 1 for women will also help. And to put that into perspective, 1 alcoholic drink can be a 12-ounce can of beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor. Smoking will also raise blood pressure, so quitting would be best. Exercise regularly will also help. It's important to get at least 150 minutes of moderate aerobic exercise per week if you can. And finally, there's a special diet called the DASH diet for those with high blood pressure that is great for keeping high blood pressure under control. The DASH diet is an abbreviation for Dietary Approaches to Stop Hypertension. Although it works great for those with high blood pressure, it is still a great guideline to follow in general to help yourself keep healthy. For grains, you want 6 to 8 servings a day, and whole grains are always a great option to increase your daily fibers. For fruits and vegetables, you'll want 4 to 5 servings for each day. For proteins, you'll want to try lean ones such as fish and poultry and go for 6 or fewer servings a day. However, for fish, you'll want to have up to 2 to 3 servings in a week to avoid consuming too much mercury. For dairy, you want to try low-fat or fat-free options and have 2 to 3 servings a day. For nuts and seed, you'll want 4 to 5 servings per week. And although this is everyone's favorite category, you'll want to try your best to limit fats and sweet. However, you do not have to completely remove them from your diet. Having 5 or fewer servings a week should be fine as long as it's in moderation. And finally, we'll have salt, which can actually be a large contributing factor to high blood pressure. You want to be aware of the recommended daily amount of sodium, which is 2,300 milligrams. But if you're trying to really lower your blood pressure, 1,500 milligrams or less is highly recommended. Now you may be wondering, what exactly does 2,300 milligrams of sodium looks like? Well, you might be surprised to find that it's roughly equal to a single teaspoon of salt. Pretty crazy, right? To put that into perspective, take a look at this average turkey sandwich. It's nearly 2/3 of your recommended daily sodium intake already, and that's just lunch. You may be thinking, I don't add a lot of salt to my food, but this sandwich does show that salt can be found in many places that you might not expect, such as in this turkey sandwich. A good recommendation is to opt for low sodium choices if you can. By doing so, you can lower sodium content of that sandwich by roughly half. Even though the recommended amount is 2,300 milligrams, the average American adult consumes more than 3,400 milligrams of sodium each day. This is why it's very important to know how much salt is in our food and to have it in moderation. And finally, the best single thing you can do to manage your high blood pressure is to take your blood pressure medication if they've been prescribed to you by your doctor. Adherence is definitely key, so please take them every day as prescribed. High blood pressure treatments sometimes require more than one high blood pressure medication, so it's important to take your medication to keep your high blood pressure under control. It can be very challenging to remember to take your medication every day, but there are tools out there that can help you. Medication lists, medication alarms, pill box, and even a phone app is a great way to remind yourself to take your medication. But what if you feel fine and have no symptoms? Well, just remember, high blood pressure doesn't typically have any symptoms. You may be getting better without noticing any changes, and that is fine. It's important to keep taking your blood pressure medication to keep your high blood pressure under control, unless your doctor advised otherwise.
And that concludes the end of this hypertension educational video. You learned so much about high blood pressure, how to measure it at home, and how to prevent and manage it. I hope you found this video helpful, and please share it with your loved ones. From all of us, thank you all so much for watching.